Now, when we're talking about those living in poverty, does that mean they're people who aren't able to find work, they're not able to find their way out of a bad situation? How would you define those who are in poverty? You said there's 45 million
45
in the
million.
United States.
Right. And every person has their own unique story and their own unique situation. Basically, I think we could say there are three, I guess you'd call them main categories. One of those is people who are in chronic poverty. They're disabled, they're elderly, there's something like that. And they probably are always going to need two things. One of them is survival assistance, and the other is friendship and somebody to care about them. Another group is what we call situational poverty. It's what we hear about, everybody is only 3 paychecks away from poverty.
Right.
These are people who have, maybe there's been a major illness, they've lost a job. They're basically on the right track, but they're going to need kind of some intense, almost triage, as they get over the kind of shock that comes with that and get their plan together and begin to move forward again. And then there are the people who are in generational poverty. Those are people who have been in poverty for 2 or more generations in the family. And those people live basically in a poverty environment. And we know that it's going to take much more long-term help for those people. It's not a matter of, if I get you a job, you will get out of poverty. Because if you first have not addressed understanding what it takes to keep a job when no one in your family has had one. If you would like your child to go to college but nobody in the family has ever gone to college, how do we do that? And how do we help that child to understand they can do that? So the generational poverty takes more time. And with the St. Vincent de Paul Society, and I think Dave's going to mention it, is that we want to walk with people as they journey out of poverty. We can't take them, but we walk with them.
Right.